A very good morning and a warm welcome to all our esteemed guests and to dear learners. I am Dr. Riya Tukral from the Homeopathic Academy by BJN RX, and we are here today to discuss a very essential topic in this scenario, that's protocol for homeopathic management of COVID-19, and this is our session 2 with Dr. Harsh Nigam. I am very happy and delighted to be learning from Dr. Harsh Nigam today. And in the first session, we already went through the protocol for the management. But in this session, Dr. Harsh Nigam has even more interesting and very practical and relevant knowledge for us to share with. And we are very happy to have him here. But as it is customary, before going ahead with this webinar, let me quickly introduce the Homeopathic Academy to you and our association with Dr. Harsh Nigam through this academy. So let me quickly give you an overview. So the Homeopathic Academy, or THA as we call it, is BJN RX's effort towards digitalizing homeopathy and providing a platform for quality education online. THA offers you a range of online courses by well-known academicians on numerous subjects of homeopathy at undergraduate, postgraduate, UPSC and CME levels. All these courses are enriched with state-of-the-art audio-video technology. There is a dynamic and qualified development team that works day and night on each course and brings to you quality education. And we have a team of doctors, video editors, and many more professionals working on it constantly and updating it and making it absolutely relevant and practical for you. And these courses will complement your studies to make learning an extraordinary experience, as I always say. So on your screens, you can see some of our courses that are currently streaming on our website, www.thehomeopathicacademy.com. The first course that you can see on your screen is Dr. Harsh Nigam's course, and that's called Modus Foundation and Modus Prescriber. So these are actually two courses that we also provide as a combined course, or you can even buy them individually as you like. So the Modus Foundation is mainly the principles of homeopathic prescribing, and Modus Prescriber is the methodology of homeopathic prescribing. So in this course, Dr. Harsh Nigam will teach us how to adapt concepts of organon in modern clinical scenario and improve our clinical practice, a very essential need for all us modern homeopaths. So these are some more courses that we have. I'll quickly go through them, not taking much time. So this is a brand new course by Dr. Philip Bailey on comparative homeopathic psychology. And also we have Dr. Frederick Schroyen's course on 4 ways to rejuvenate your practice. We have Dr. Banerjee's very much loved course of ours, that's miasmatic prescribing, learning the art of rapid classical miasmatic prescribing. And then there's homeopathic facial analysis by Dr. Bentley. And here comes Dr. Harsh Nigam's course, as I told you, methodology and principles of homeopathic prescribing as a bundle. Then quickly going through other courses as well. You can log on to our website www.thehomeopathicacademy.com to see these courses. And also we have some courses coming up very soon, which are under production right now. That's on pharmacy, pediatrics, and infectious diseases. That's a UG level courses. So that's a little about us. Thank you for listening, and coming back to this webinar, let me quickly introduce Dr. Harsh Nigam to you if for any chance you are here with us for the first time. So you should know who our eminent speaker for today is. So Dr. Harsh Nigam, about him a little. So Dr. Harsh Nigam is a renowned practitioner and an author of 8 books on homeopathy and 12 research papers published in various Indian journals. Despite having obtained MBBS and MD in physiology, he could not suppress the heritage of homeopathy that he received from his homeopathic father, Dr. Jagdish Chandra Nigam. Dr. Harsh has obtained his membership of faculty from the Royal London Homeopathic Hospital, UK. He is spearheading a multi-speciality OPD hospital at Kanpur, a center of excellence in medical homeopathy, and he focuses on research-based medical solutions to various health issues. He aims to establish homeopathy on its scientific merit. And you can also see some of the books, some of the internationally recognized books by Dr. Harsh Nigam, that's Principles and Practice of Homeopathic Case Management, and Miasma, The Road Less Traveled. He's the nominated member of editorial board of IGH, and he's an ex-member of Special Committee of Clinical Research at the CCRH, New Delhi. Also, to let you all know, for today and tomorrow, I have a special offer for you from THA. If you buy Dr. Harsh Nigam's course today or tomorrow, you will get this book on Principles and Practice of Homeopathic Case Management by Dr. Harsh Nigam, complimentary with the course itself. So you can complement your reading with our quality video lectures by Dr. Harsh Nigam himself and actually understand what he wants to, wants us to learn, wants us to experience by him directly. So that's a little about him. Okay, so without wasting any more time, thank you, sir, for being here with us. And before I hand over to you and call you up live, let me explain our learners how this interface works. So on the right-hand side panel of your screens, you have a short chat box. You can type your questions or whatever message you have for Dr. Nigam right there and press the button next to it to send it to us. I request you all to send your questions only after Dr. Nigam's lecture is over, as that might disturb him, and we wouldn't want that. I don't want any of us to miss anything. Also, if you have not attended the session 1 of this webinar, don't worry, you can visit our website, and under the page Dialogues, you can find the recording of Dr. Harsh Nigam's first session with us on the protocol. So without wasting any more time, let's start learning. So please come live with us so everybody can see you.
Yeah, good morning, everybody. Good morning, Dr. Ria.
Good morning, sir. We are ready to learn from you.
Very good. So I'm also ready. There was a technical glitch, but we are now ready. Can you put on the presentation, please? Yeah, the PowerPoint.
Yes, sir. Yes, sir. Definitely. Here goes.
So, right. So today we are going to talk about the Borland's pneumonia protocol. Now, this is very important. You will be surprised to read Borland's little book on pneumonia. And the only thing that you need to know is how to adapt Borland's work to today's pneumonia scene that COVID-19 has brought up again. You see, homeopathy was very successful with pneumonia before the antibiotic era. Now, once antibiotic came into being, homeopathy got neglected for pneumonia. But now with the advent of several viral diseases, then antibiotic resistant pneumonia, then so many kind of fungal aspirational pneumonia, allopathy, the modern medicine, is now lagging behind. They don't know what to do. Herein, we are going to play a very, very important role in management of pneumonia. And if you scan homeopathic literature, then you would see that Borland's work is a landmark work on pneumonia. He has done tremendous service to homeopathy in his little book on pneumonia. The problem is that we have not explored this book in a modern view. See, Borland was working with pneumonia in a hospital setting. He was seeing pneumonia patients day in and day out. And he adapted homeopathic principles in hospital setting with patients who were IPD patients, and he developed a way of prescribing, a way of giving the medicine, a proper protocol. He was not prescribing on the basis of red hepatization, gray hepatization, etc., etc. He was prescribing on the basis of what was the presentation of the patients, and then he classified pneumonia in his own clinical way. And many people who have seen me prescribe, who have seen my father prescribe in acute cases, always question us, why do you prescribe high potency so frequently? Now, if you would see how Borland used to prescribe, you would come to, and the results that he gave, you would come to understand where we come from. You see, Borland was so confident in his prescribing and the results that he got, that he would say that an ordinary case of pneumonia is going to clear up in 6 hours. Can you imagine that? It would not take more than 2 to 3 days to clear up pneumonia with homeopathy. So that is the power of homeopathy that Borland developed over pneumonia. And I have done it over the years. My father did it over the years, over decades. And with COVID, I've been experimenting this again and again. And the results are magical. So I'm coming up with Borland's pneumonia protocol for you, trying to modernize, trying to give you the crux of the matter in a modern way. Now you see, Borland's pneumonia protocol are applicable mostly for moderate to severe and severe to critical COVID-19 cases. For mild cases, classical homeopathy is the best way of prescribing. But for mild to moderate and moderate to severe and severe to critical, Borland protocol are wonderful. But before going into Borland's pneumonia protocol, we would have to first, revisit pathophysiology of pneumonia. Many of us have forgotten the pathophysiology of pneumonia. And when you have to understand Borland's pneumonia protocol, you would also have to understand what Borland is trying to stress upon you. That you would have to be a clinician first and then a homeopath. So you would have to understand physiology and pathophysiology of pneumonia. So here goes. Before understanding the pathophysiology, the epidemiology of pneumonia, about 2.56 million people died from pneumonia in 2017. Almost a third of all victims were children younger than 5 years. So it is a huge global problem. Pneumonia is the leading cause of death for children under 5. The global mortality rate of older people remains unchanged since 1990. About 15% of COVID-19 cases are severe and have pneumonia. And the basic problem with COVID-19 is that by the 3rd to 5th day, every COVID-19 case has a risk of having pneumonia. And it is said that every COVID-19 case has some kind of respiratory insult. On the 3rd or the 5th day of the fever, there is a maximum chance of developing pneumonia. So you see, with COVID-19 scenario, you would have to understand what pneumonia is and how to handle pneumonia homeopathically. Now the pathophysiology is very simple. You see, pneumonia is an inflammatory condition of the lung, typically caused by an infection. Now, if you go to the repertory, then under the chapter of chest, you would find a rubric, inflammation of the lung. Now that is the rubric for pneumonia. The condition affects the lung parenchyma. You see, the lung has two parts, the alveolar part and the parenchymal part. That is the airway part and the lung parenchyma. So the condition affects the lung parenchyma, the part of the lung responsible for the gaseous exchange. This is largely comprised of alveoli, which are the air sacs of the lung. The alveoli are located at the distal end of the bronchial tree, that you all know. A network of capillaries surrounds the alveoli. Together, the wall of the capillaries and the alveoli form a respiratory membrane. Now, what happens in pneumonia? That this respiratory membrane gets inflamed and fluid locked. And this leads to ARDS, acute respiratory distress syndrome, leading to impaired oxygen exchange. This provides a large surface area. This respiratory membrane provides a large surface area, a thin, permeable and moist surface, where the gaseous exchange of oxygen and carbon dioxide can take place. Now, the normal defense mechanism in the lung include, there are two main defense mechanisms in the lung. One is immune cells, which reside in the alveoli and phagocytose or break down the organism which come there. The other is mucociliary clearance, where hair-like projections, the cilia, sweep mucus and organism away from the lungs. And the third is the cough reflex, which can help to clear the mucus from the airway. When one or more of these defense mechanisms are impaired, organism can enter the lower respiratory tract and divide, causing an infection. Now, the basic pathophysiology is simple. In pneumonia, there is inflamed alveoli and fluid accumulation, leading to, as I've told you, lung infection. This inflamed alveoli, this inflammation can be because of a bacterial, viral or fungal infection. This can occur if normal lung defense mechanism is impaired. Inflammatory cells try to clear the infection, but instead inflame the alveoli, which can cause a fever with chill. Now you see, these inflammatory cells, they release interleukin-6, and this interleukin-6, if it rises to an alarming degree, leads to a cytokine storm having a global effect, which is very, very dangerous, which leads to an emergency. Then there is another thing, which is fluid accumulation. Fluid accumulation can occur in the alveoli due to the capillary leaking. Because of inflammation, there is capillary leakage causing fluid accumulation from the circulatory system. This can result from inflammation caused by a bacterial, viral or fungal infection of the lung. This can result in poor gas exchange, leading to fatigue, shortness of breath, which is called dyspnea, and coughing, often with phlegm. But in COVID-19, it starts with a laryngeal problem, with a pharyngeal inflammation leading to dry cough. Later on, when the infection reaches alveoli and there is pneumonia, then you have productive cough, but which is very difficult to expectorate. And in this case, hospitalization may be required, where you can manage the case either with antibiotic or with respiratory support, or with both, or with homeopathy alone, or with homeopathy in combination with other modalities. Now, the symptoms of pneumonia can develop very quickly, especially in COVID. They develop very, very quickly in over 24 hours. In other cases, in bacterial pneumonia, etc., they develop slowly over several days. Now, the basic symptoms are fever, cough, and dyspnea. Then there is chest pain, and chest pain can result from inflammation in the alveoli, which has spread to the outer covering of the lung and the pleura. Basically, it is pleuritic pain and the lung pain. This prevents the lung expansion properly during inspiration, leading to extreme discomfort. And this can also be seen with different postures that the patient attain, and these postures can sometimes be a quick bedside differentiation in diagnosing homeopathic medicines. Now then, there are classically different stages of pneumonia. Pneumonia has 4 stages that we have been told of. Stage of consolidation, stage of red hepatization, stage of gray hepatization, stage of resolution. And in many homeopathic books, you would find medicines as per stage of consolidation, stage of red hepatization, stage of gray hepatization, stage of resolution. But Borland, with his clinical wisdom, has not given you a protocol based on these stages. And he has been very wise in doing so, because he has given you a clinical classification. And that clinical classification is going to help you in your clinics, in your bedside prescribing. But anyways, we would like to know what these stages are. To recollect these stages, the stage of consolidation occurs in the first 24 hours. Cellular exudates containing neutrophils, lymphocytes, and fibrin replaces the alveolar air. Now the air is replaced by cellular exudates. Capillaries in the surrounding alveolar walls become congested. The infection spreads to the hilum and pleura fairly rapidly. Pleurisy occurs, and it is marked by coughing and deep breathing. Stage of red hepatization occurs in 2 to 3 days after consolidation. At this point, the consistency of the lung resembles that of liver. The lung becomes hyperemic. Alveolar capillaries are engorged with blood. Fibrinous exudates fill the alveoli. This stage is characterized by presence of many erythrocytes, neutrophil, desquamated epithelial cells, and fibrin within the alveoli. Stage of gray hepatization occurs in 2 to 3 days after red hepatization. This is the avascular stage. The lung appears gray-brown to yellow because of fibrinopurulent exudates, disintegration of red cells, and hemosiderin. The pressure of the exudates in the alveoli causes compression of the capillaries. Leukocytes migrate into the congested alveoli. Stage of resolution. This stage is characterized by the resorption of and restoration of the pulmonary architecture. A large number of macrophages enter the alveolar space. Phagocytosis of the bacteria-laden leukocytes occur. Consolidation, tissue aerates, and the fluid infiltrate causes sputum. Fibrinous inflammation may extend to and across the pleural space, causing a rub hurt by auscultation, and it may lead to resolution or to organization of pleural adhesions. Now this is pathological. Now in modern days, if you would go to a hospital, you would find a different nomenclature. Now this nomenclature you must be updated to. We classify different type of pneumonia into various groups. This allows us to describe the disease more exactly and, more importantly, to start off the correct treatment. And you must be aware of this because you are a modern homeopath. You would be dealing with modern physicians. They would be discussing to you in modern terms. And if you are not aware of these modern terms, you would be, feeling confused. So the various types of pneumonia are classified according to a number of characteristics. To treat these types, it is essential to know whether somebody caught pneumonia at home, in a hospital, or in a nursing home. So if somebody caught pneumonia at home, it is called as CAP, CAP, community acquired pneumonia. Even if you are later on admitted into the hospital during the course of illness, if you caught pneumonia at home, it is called as CAP. community acquired pneumonia. Then there is HAP, hospital acquired pneumonia or nosocomial pneumonia. Pneumonia is considered to be nosocomial if it starts at least 2 days after you are admitted to the hospital or within 3 months of a hospital stay. You were admitted into the hospital, you did not have any pneumonia in the hospital, you came back home, within 3 months of hospital stay, you developed pneumonia. This would be called as HAP, hospital acquired pneumonia or nosocomial pneumonia. Now, what is typical or atypical pneumonia? Now, COVID is a typical pneumonia. Generally begins with a sudden high fever and chill, coughing and phlegm comes later. Now, atypical pneumonia is caused by other germs which are also referred to as atypical germs. Older people in particular have fewer or slightly different symptoms and they are also classed as atypical pneumonia. It starts rather slowly and with a mild fever or even without fever or very, very low grade fever, only with headache and aching limbs. Instead of coughing with phlegm, atypical pneumonia has a dry, tickly cough. It is sometimes called as walker's pneumonia. People are walking about and still having pneumonia. Atypical symptoms do not mean, remember, atypical symptoms do not mean that the lungs are less severely inflamed or that the disease will take a milder course. It is going to be as severe, as threatening as a typical pneumonia, but it is masked. You may be fooled because the symptoms are not typical. That is why it is called atypical pneumonia. Now, pneumonia can be also divided as mild, moderate, or severe pneumonia. I have already told you when we were talking about the protocols of COVID-19, how to differentiate between mild, moderate, and severe COVID-19. The same applies here. But here I would tell you how pneumonia, you can divide pneumonia into mild and moderate and severe. If the patient is younger than 65-year-old, he is conscious and lucid, which means he can talk sensibly, has normal blood pressure and pulse, is not breathing too fast, that is, his respiratory rate is less than 30 breaths per minute, has enough oxygen in his blood, that is SpO2 is more than 92%, has not been given any antibiotics in past 3 months, has not been in the hospital in past 3 months, does not have any other severe medical condition, that is, does not have any comorbidity, then you would label him as a person, and he is having pneumonia, then he would be labeled as a person having mild pneumonia. On the other hand, signs of moderate pneumonia include drowsiness and confusion, low blood pressure, worsening or shortness of breath, risk factors such as old age and underlying diseases like diabetes, hypertension, and COPD, the comorbidities, and people with these symptoms need to have treatment at hospital. It is very important. Even if they are treated at home, then you would have to manage them very cautiously with the oxygen support, at least with nebulization and constant monitoring. Now then, when you are going to take an X-ray or do a CT scan, then you would understand whether the pneumonia is lobar, bronchopneumonia, alveolar pneumonia, interstitial pneumonia. You know, X-ray plays an important role in distinguishing between these types. Now you must understand, lobar pneumonia is used if an entire lung lobe is visibly inflamed, depending upon which lung lobe is affected. And you must understand, I must impress upon your mind that lobar pneumonia is unilateral. It can affect upper, middle, or lower lobe. So it can be upper, right, lower pneumonia, upper, middle. It can be middle, left, lower pneumonia, but it is never bilateral. So lower pneumonia is unilateral pneumonia. If there are several multilobar focal inflammatory patches in the lung, the term focal pneumonia is used today. But in homeopathic literature, you would find the word bronchopneumonia. So do not be confused if somebody uses the term focal pneumonia. For you, the rubric in homeopathy would be bronchopneumonia. If the focal inflammation started in inflamed bronchi, then it is bronchopneumonia. If the air sacs are involved, then it is alveolar pneumonia. And if the tissue between the sacs is involved, it is interstitial pneumonia. But this is fine distinction. This can only be seen on a CT scan. Very rarely it can be seen on an X-ray. So it is all bronchopneumonia in homeopathic literature. Now you can see the difference. If you see a lobar pneumonia, now this white thing, this black is gas. In an X-ray, a gas would be seen as black and a consolidation would be seen as white, opaque. Now this is a lobar pneumonia because it is unilateral. Now this is interstitial pneumonia because it involves interstitial spaces and you have GGOs, ground glass opacities, and it is bilaterally symmetrical. Then you have bronchopneumonia, you have central bronchi involved, there are patchy bilateral diseases and asymmetrical peribronchial cuffing. So this is bilateral pneumonia. This is bronchopneumonia. With COVID-19, there is a typical thing which is seen, especially in CT, which is called as peripheral ground glass appearance. If you would visit my previous COVID protocol webinar, you would see I have given you a CT picture of ground glass pneumonia, which is almost diagnostic of COVID-19 infection. Now coming to how Borland has classified pneumonia. He has classified pneumonia into 4 groups. Group 1 is incipient stage. Normally, a person is not going to present to you in an incipient stage because this is a stage of first 24 hours. And in first 24 hours, nobody comes to a homeopath for medicine. You may see these cases at your home or somebody in your relation, but they are mostly not going to present to you directly. Group 2 is very important, frankly developed pneumonia. Group 3, complicated pneumonia. Now, complicated pneumonia, Borland describes as 2, mixed pneumonia and bronchopneumonia. What are these we are going to talk about? Then group 4 is late pneumonia. Now the medicines that he has given for these stages, for incipient stage, he gives us aconite, ferrum phos, belladonna and ipecac. Now we all know how to differentiate between aconite, ferrum phos, belladonna, ipecac. We are not going to dwell much upon that. Group 2 is important, frankly developed pneumonia. Now these are the cases, they are mostly going to come to you. They are, and you must know how to differentiate between bryonia, phosphorus, veratrum viridi, and chelidonium. Now, chelidonium would be a surprise to you, but chelidonium is a very important medicine for pneumonia. And many a time, when you give bryonia, actually, and the patient doesn't respond, It is a chelidonium case. Now, complicated pneumonia in group 3, which I would say group 3A, mixed pneumonia. Now, these are the cases which have septicemic tendencies, where you would see TLC is getting high alarmingly. These are the cases where, along with COVID-19 infection, you are going to find septicemia, TLC is getting high, CRP is getting high, and there you would see PCT, procalcitonin, is also getting high. So you would now understand that this is a case which is going to rapidly end up into a septicemic crisis if you do not give them the right homeopathic medicine. And herein, you would have to decide on the type of fever the patient has. If the patient has fever with heat or fever with heat alternating with chills, then the medicines that you would have to differentiate would be Baptisia, Pyrogen, Lachesis, and Marxol. These would be the 4 medicines that you are to differentiate with. And if the mixed pneumonia group 3A fever is with chill only, then the medicine would be that the 2 medicines to differentiate would be Hipersulf and Rustox. Then coming to bronchopneumonia. Now you see the pneumonia is spread and spread to both the lungs. And herein you have 4 remedies. And bronchopneumonia is a classic COVID-19 pneumonia scenario. When you see a case of COVID-19 wherein IL-6, interleukin-6 is elevated, where CRP is elevated, patient is coughing, patient is having dyspnea, patient is having LDH elevated, and you go in for a CT scan, you would mostly find bronchopneumonia, that is bilateral pneumonia with GGOs, ground glass opacities, which are peripheral in nature. Now you have shortlisted your remedies. They would be natrum sulf, pulsatilla, senega, or lobelia. They can be any other remedy in the materia medica provided your repertory shows up. But according to Borland's protocol, you shortlist natrum sulf, pulsatilla, senega, and lobelia, and you must know how to differentiate between them. I will tell you later on. And then there is group 4, late pneumonia. Now, late pneumonia are pneumonias which are actually severe pneumonias. These are severe to critical pneumonias. These are hospital-bound cases. These are cases which are in cardiorespiratory failure. These are the cases which either you do not touch because they are run down, they need ICU settings, or if you touch, then you must be very confident. And the patients, you must tell the patients that these are the patients who are in a touch and go situation. So you must take the patient's attendant into confidence, and if they are ready, then only you touch these patients. And there would be some patients who, because of financial constraints or because of some other constraints, would say that Dr. Saab, I would like you to treat the case and I would not take my patient to the ICU. Then you must be ready with your medicines. And I would tell you, I have seen the magic of homeopathy in these cases. I have seen IL-6 more than 5,000 getting to normal within 5 days with homeopathy. That is the magic of homeopathy. And the medicines here are antimonium tart, carbo-veg, kali-carb, lycopodium, arsenic album, and sulfur. How can you imagine sulfur being used in an acute case in a high potency? But remember, Borland is a confident prescriber. He has prescribed thousands of cases of pneumonia, and taking Borland's cue in COVID-19 acute cases. I have also prescribed sulfur in this COVID-19 scenario with beautiful results. Not in every case where sulfur was indicated, I have prescribed sulfur and seen beautiful results. So, before getting into the materia medica part and differentiation of medicines, let us try to understand how this magic is done and how Borland has done it. And Borland is the first person who has written down honestly without any fear that how he prescribes in acute diseases. And nobody has written down so clearly and so confidently in homeopathy the prescription of high potencies in acute diseases, not even Kent. And you must remember that Borland was working very closely with Margaret Tyler. Margaret, all the small booklets of Borland, they are worth a read. And many of them are written in collaboration with Margaret Tyler. And Margaret Tyler, as you know, was direct disciple of Kent. So I assume, this is my assumption, and I think I am true, that whatever technique Borland is telling you is the technique of Kent. Because Kent has always told us about high potencies, but he has never given us detailed protocol or detailed way of using high potencies. But Borland has given us. And his prescribing ground rules are, first, he writes, the point is this: in homeopathic prescribing, your endeavor is to find a drug which will cover not only the actual pathological picture, but also the reaction of the individual patient to the disease. Now, this is very, very, very important. Your drug should always cover the pathological picture along with the reaction of the individual patient to the disease. That should be the true totality. Your first endeavor is to find the group of drugs which produce the symptom complex of a pneumococcal infection or of pneumonia, so to say. That is what you do when you make a genus epidemicus. In my previous webinar, I have told you, when an epidemic is prevalent, what you do, you make a genus epidemicus and you select a group of remedies, and I have given you a group of 10 remedies. Then from that group, your second point is to choose from that group the individual drug which covers not only the pneumococcal, which means the pathological symptoms of the epidemic, but also the manner in which a patient reacts to the infection. Now, this is the right way of moving ahead in acute diseases, especially acute emergency kind of diseases, infective kind of diseases like COVID-19. I must tell you, right now, I have treated more than 170 cases without any death, without any ICU admission. There have been 4 or 5 cases who have left because they were not, although they responded very well to the treatment, but since they had money and they were afraid of pneumonia, they went to Max Hospital and big hospitals. But nobody had any adverse problems with homeopathy, and all were satisfied. You know, in spite of so much negative publicity that homeopathy does not work, it is placebo, etc. I started with 1-2 patients, and patients kept on increasing. Why? Because they kept on coming by word of mouth that we have improved, go to Dr. Nigam. This is what happened, and this is what is going to happen with you. This is what has happened with many of my pupils who have been working in different cities, and they all have had positive response. This is because they have all been working with high potencies, and they have unknowingly been taught the way Borland and Kent used to prescribe. They understand that this is the way of prescription that Dr. J.C. Nigam has taught them. Through me, they have learned this. Through Dr. J.C. Nigam, they have learned this. But this is actually Borland's and Kent's prescribing. Let's see how. The whole of your success in homeopathic prescribing depends on your power of recognizing which symptoms are common to every case of infection by a specific organism and which are dependent on the individual reaction of the patient who is infected. This is very important. The individual reaction symptoms are striking, singular, uncommon, peculiar symptoms, and the symptoms caused by the specific organism in an epidemic are the common symptoms. But you are to take both in your repertory work. So do not imagine that the practice of homeopathy is going to make your clinical medicine of less use to you. On the contrary, homeopathy is going to take advantage of every iota of clinical knowledge and experience. The more you use your clinical sense, the more successful you are going to be. This is something that I would like to stress upon your mind. Do not only become a homeopath, become a clinician first and homeopath next. Then only you are going to be very, very, very successful. We are always hearing that we homeopaths are symptom hunters, that we prescribe on symptom alone. We do nothing of the kind. The only successful homeopathic prescriber I have known has been the most observant clinician. Instead of tending to neglect one's clinical work, one pays more and more attention to it, and it steadily improves. And it is on that successful homeopathic prescribing depends. When you are dealing with acute disease, there are two attitudes of mind you can adopt. Now, Borland is dissecting the mind of a homeopathic physician while he is prescribing. Now, when you are dealing with acute diseases, there are only two ways you work. The first approach is that you play safe, where it is maintained that in acute disease, if you restrict your prescription to low potencies, you avoid the complication of the disease, you make the patient more comfortable, and you reduce your mortality rate. Now with low potencies, what Borland understood, what I understand, what I've written in my book, and what is true is any potency less than 30 is low. Because we get 12 till 12 potency, no? And till 12 potency, it is medium and low potency. Above 30 is any potency above 30 and above is high potency. So the first approach is when you play it safe, you give low potency, that is below 30, which is 6, 12, 3, 6, 12, etc. You can only make the patient comfortable. You see to it that there are no complications to the disease, and you reduce the mortality rate. But the disease is going to run its full course. You cannot abort the disease. So what do? The second method of treating acute condition is by administration of above 30. You will find that by higher you go, the quicker you abort the prescribing. The disease does not run its normal course. The duration of illness is very much shortened, and you have an anticipated crisis. You know that the disease which was to run for 3 weeks is going to be aborted in 3 days. Instead of getting the crisis from the 7 to 10 days in a pneumonia, you get it from 12 to 48 hours after starting the treatment, irrespective of the day of the disease you start prescribing on. But you have precipitated a crisis because you've given a high potency, you precipitate a crisis. You understand, by crisis we mean sudden drop of temperature. There are two ways of dropping temperature: crisis and lysis. Lysis is slow drop of temperature. Crisis is a sudden drop of temperature. So with high potencies, you suddenly drop a temperature. You have precipitated a crisis, and a crisis is always attended by a certain amount of risk. Do not use high potency in continued fever. In low-grade fevers, do not use high potencies. Use high potencies in healthy patients to start with, instead of those in whom vitality is impaired by long toxemia, like cancer patients, like worn down tubercular patients. Do not use high potencies in them because they are going to break down. When you are using low potencies, you have to keep up your drug administration right through the course of disease. You will probably find that you have to give more than one drug. Your first drug modifies the picture, and you then get indications of a second prescription and possibly a third before a crisis takes place. When you are using high potencies, it is advisable to continue the administration of the selected drug until the temperature has reached normal and has remained normal for at least 6 hours. Now, this is very important. As soon as the temperature becomes normal, you do not stop the medicine. This is a very, very important point. Keep on repeating the medicine until the temperature has remained normal for 6 hours. Otherwise, you will find the patient tends to get a further rise in temperature and will require a second course of medicine. Maybe the same medicine, but possibly a different medicine, say 24 hours later. Whereas if you have kept up your administration for 6 hours after the temperature has become normal, you do not, as a rule, get any relapse at all. Try these things. These are beads of wisdom, pearls of wisdom given by Borland. I've tried it, they work, and they are valid. Try these things. As regards the frequency of administration of drug, where you are using a low potency, it is quite sufficient to give the drug about once in 4 hours. Jot it down, do it. If you are using 6, 12 potencies, give it in 4 hours in acute diseases. But as far as high potencies are concerned, it is wiser to give the drug every 2 hours. The reason being that you want a number of stimuli in comparatively short period of time in order to obtain the crisis within 12 to 24 hours. It is something said that certain drugs are effective. It is sometimes said that certain drugs are effective in high potency and certain drugs are effective only in low. This is all hogwash. It is not so. The higher you go, the more accurate the prescribing must be. In lower potency, a general similarity is enough to give an effect, but your prescribing in high potency must be very, very accurate. Now, Borland had a definite plan while he was examining his pneumonia patients. Whenever he was examining his pneumonia patients, he used to first see what is the rapidity of onset of pneumonia. Then, what is the facial expression of the patient? What are the concomitant conditions? What is the mental reaction of the patient to the disease? What are the striking particulars? What is the literality of the involvement of pneumonia? Which side is involved? Although in many of the cases, like in many pneumonias, it is bronchopneumonia, no fixed literality, but sometimes you see in some certain medicines, their literality is quite marked. Then, what is the type of cough? What is the type of sputum? And then you should differentiate between similar drugs. Now, this is the way he moved in his work. Dr. Ria, this is the end of the first part of Borland's classification.
Yes,
Do we
sir.
have time to move into the second part, or
So I guess it's 12:26 already. So if
because
you
it is a
want to
longish
go
and
ahead, and
it is a very
it
longish
will
and
again take another hour.
yeah. It would take about 1 to 1.5 hours. If somebody wants to talk to me about, we can go in for question and answer thing, or we can go
Yes,
into
sir.
the details of the differential diagnosis of medicines.
I think so. We like to do it more deeply and better. So let's take another session for the
You
continuation
would
of
have to
this.
decide on the date of because I would like to keep it early, because then the memory would be fresh for this.
Okay, sir. Okay, sir. I'll let you know the possible dates as soon as possible then.
Yes, ma'am. So now we're going for question and answer session.
Yes, sir. Definitely. So
And
you
answer.
heard everyone send us your questions. Dr. Nigam will take your questions as many as we can today, or else we'll go for the session 3 and we'll let you know the date very soon on our social media handles. So quickly give us the questions, everyone. Type in the chat box right now. Okay, already we have a question, sir, if you'd like to take up. So a learner wanted to know the group remedies that you stated in the Sorry for the technical glitch, sir. So a learner wants to know if if the group of remedies that you stated earlier are they from the Borland's pneumonia itself?
Yeah,
Okay.
they are.
Okay, sir.
You would have to read the booklet, and it's an eye opener actually. I have added nothing to Borland's pneumonia. It's undiluted Borland's work.
Yes, sir. Okay, sir. A learner wants to know what is your opinion about COVID in a nosode?
COVID in a nosode is quite early to say, because COVID as a nosode is going to work one day, as influenza is working nowadays. But it's quite early to say, because we are yet not knowing the whole extent of the disease and how it has affected the mankind truly. So it would take some time to understand the whole effect of COVID on mankind. It is not only pneumonia, there are certain other things that are happening along with pneumonia and respiratory problems. So time would tell what is going to happen with COVID nosode, and let's see, let's wait for it. What we should prepare right now is not for COVID nosode, but for the vaccinosis that is going to develop with this Pfizer vaccine and other vaccination drive that is going to happen. That is going to be a great challenge for us homeopaths. Why? Because these vaccines are going to create a havoc on population. There is going to be a wave of vaccinosis, in a new wave of vaccinosis, as Burnett has told us. Please, all you young kids, all you young people in homeopathy, read Vaccinosis by Burnett. It is a small book, because this is the next great challenge that is going to come up. A wave of chronic disease after these COVID vaccinations. You see, it has already started happening. Several of my friends who are in UK, who are doctors, have been given Pfizer vaccines, and Pfizer vaccines have they immediately cause a flu-like syndrome. And this is happening with every patient who gets Pfizer vaccine. They get flu-like syndrome. There are amongst my friends and their patients, there is a report of 2 cases of Bell's palsy from Pfizer vaccine. So things are going to come up, and therein, COVID nosode is going to be of great help. These, the vaccinosis of vaccine, of COVID vaccine, is going to be tackled by COVID nosode. For that, we would have to be prepared. So this is one fresh approach that I'm giving you for the use of COVID-19 vaccine. The COVID-19 nosode that we and beware, it's going to be an explosion of chronic disease after this.
Yes, sir. Thank you so much, sir. So let's take a last question before we wind up for today. So a learner wants to know, what is the role of tuberculinum in COVID-19 in your opinion?
Beautiful question also. Instead of thinking about tuberculinum, I would like to shift your mind towards tuberculinum aviare. So if you go to Boeric, and in relationship to tuberculinum, you would what you would see is that there is a medicine by the name of tuberculinum aviare. Now, tuberculinum aviare is a wonderful medicine. You get a case of bryonia. It's a typical case of bryonia with all the modalities of bryonia. You give bryonia, the patient responds well, but the coughing continues. And you see the patient is still having respiratory distress. Now what you do is you put your stethoscope on the chest and you see that there are rails, there are coarse crepitations. And this is a case of, mind you, a typical case of influenza or COVID-19. And what you see is that when you put a stethoscope, that the influenza is now rapidly shifting towards the lung. Now, this is a stage where pneumonia has completely not, this is a stage where consolidation has started but not fixed. There is no red, you come to understand with experience that it is a stage of consolidation, but no red hepatization has taken place, which means phosphorus is yet not indicated. There is no red sputum or streaks of red bloody sputum. At this point, when phosphorus is not indicated, you have loud rails and bryonia is failing. You give AVR and you give tuberculinum aviare and you see magic happen. It's going to clear up the case in 24 hours. And you would not require phosphorus and nothing, and you give AVRA in 1M and 10M and repeat it every 1 to 2 hourly, and you see magic in 24 hours. And the case is going to completely clear up in 24 to 48 hours. You won't require any other medicine.
Okay. Thank you, sir. Thank you so much for so much practical knowledge and enlightenment. I think let's wind up here. We are running out of time already, not taking up more of your time. So, dear learners, I hope you all loved the session as much as I did. We will have the session 3 of this topic very soon. As soon as I have a date confirmed with Dr. Harsh Nigam, we'll let you know. And you will continue learning with Dr. Nigam very soon. So thank you everyone. Thank you so much, sir,
You guys,
for being here, for the knowledge. Thank you, sir. And to inform all our dear learners that you can buy the combined course, enroll in it, the Modus Foundation and Modus Prescriber on THA in the website that I had mentioned, and you can enroll in it, and you will have a complimentary free book on principles and practice of homeopathic case management by Dr. Harsh Nigam, so that you can counteract your reading with practical knowledge and a great quality video lectures to understand it better by Dr. Harsh Nigam himself. And I think there is a poll on your chat window right now. Please send us your reviews for today's webinar. And if you would like any more information on the webinar or on the course, you can mail us at info@the.com. We'll be happy to help you with anything. So let's wind up here. Thank you, everyone. Thank you, Dr. Nigam. And sorry to those whose questions I couldn't take up because we were running out of time. And we will see you again with another session on 19th of December, 4:30 p.m. That's by Dr. Nikunj Trivedi on conquering infertility with clinical homeopathy. You will soon receive the link of registration by the chat window. It's for you, so that you can quickly register yourselves. And thank you, everyone. Thank you, Dr. Nigam, again. Thank you for joining. Have a great day. Keep learning, keep improving. Bye, everybody.